Good morning. Today's lecture will be a short lecture on the hip joint muscle actions, just for a review. So the first one that we're going to start with is the iliopsoas muscle. We'll go through the movements first. You can see how it inserts on the lesser trochanter. Here. This aids in flexion of the hip. We also see the external rotation, so the ability to move the hip joint in external rotation. With this, also, we should note that the origins sometimes become compromised. The iliopsoas, its origin is from T12 to L1 to L5. So looking over here, we'll notice that this region, especially when we get into pelvic tilts next week, will show how this can compromise or any tightnesses that occur from the hip are going to directly be contributing to tightness to the lower back, and vice versa. Anything coming from the lower back can cause the tightness in the extension principle of the hip. Rectus femoris, we talked a lot about this with the knee lecture, but again, for review, its main job is for hip flexion. It also does knee extension, and one of the deviations that we'll look at next week is going to be anterior pelvic rotation. Again, so as we look at the origin, the anterior inferior iliac spine, when this region becomes tight, it's going to cause the hip joint to move in or displace the anterior superior iliac spine to displace in a forward position or deviate anteriorly. So what it'll do is, as this muscle becomes tight, it'll cause the ASIS to shift in an anterior direction, which then will cause an increase of the anterior tilt in the posterior aspect of the pelvis. The sartorius, the longest muscle in the human body, its origin is the anterior superior iliac spine, and it inserts into the medial condyle of the tibia here. Some of the key features is it is a primary hip flexor. Again, it does external rotation, but it can also aid in knee flexion. What that means is that first, when you go into hip flexion, so if you do go into hip flexion, you can see how the insertion will then aid the tibial joint or the knee joint to go into knee flexion. It also is associated with the anterior pelvic tilt, which again can lead to tightness through the front of the hip. So the inability to take the pelvis into extension. The pectineus, a very prominent short muscle. If you would sit on the floor with your feet together, this would show you the tightness that may occur in the pectineus. So when we look at the pectineus, again, we're looking at how it causes external rotation of the hip. It can also be a powerful adductor, so it aids along with adductor magnus and longus, and then it also does flexion of the hip. So because we have this connection with the pelvis to the linea aspera just below to the lesser trochanter, it can also aid in flexion of the hip. The adductor muscles, most importantly, as the name suggests, they do a lot of adduction, but they can also do other movements such as external rotation. All of these muscles, the adductors, are going to be greatly associated with glute activation. So when you're thinking about adductors, the more strength that you have in your adductor muscle, then more strength you're going to have in the glute muscle. And we associate that with the lower cross syndrome. If your glutes are strong, your core is strong also. Adductor longus, this one primarily does adduction. Adductor magnus does two movements, particularly it adducts the hip. So here we see adduction. But then again, we also get into external rotation because the origin is located on the pubis and it's going the entire length of the linea aspera. So this also can cause the hip joint to go into external rotation. The gracilis muscle, it's a weak flexor, even though we see it originate at the ramus of the pubis, and it inserts on the medial surface of the tibia below the condyle. It aids in a little bit of protection of medial support, dynamic stability in the knee on the medial aspect. But more importantly, its main job is to do internal rotation. Hip internal rotation tends to be the most deviated rotation due to all the tight posterior muscles. So when we're looking at all the deep external rotators, usually we see dysfunctions in the posterior aspect, which is going to lead to weakness in the anterior, especially with hip internal rotation. It also does a weak flexion of the knee. So you can see here as the insertion is on this tibial condyle surface, it aids in a little bit of weak flexion. The biceps femoris, we talked a lot about the bicep femoris, especially when we're looking at the relationship between biceps femoris and gluteus maximus. One of the things about biceps femoris is just remembering that it aids in hip extension. We're going to see that next with gluteus maximus. So gluteus maximus and biceps femoris work particularly well together when we're talking about extension. So if you were standing with your feet together and move your foot back 10 degrees, you'll feel the hamstring. So the bicep femoris would be coming down this way. You would feel the bicep femoris contracting, and on top of it, you would feel your gluteus maximus contracting. The external rotation of the hip here, so it does external rotation of the hip. The upper fibers assist in abduction, and the lower fibers assist in adduction. But more importantly, this is what gives the posterior pelvic rotation. So one of the deviations that we see most often is in the anterior plane. And when we see people who have an anterior pelvic tilt, we tend to see a lot of tension in the lower back. And then if there's tension in the lower back and we see that dysfunction, then we usually see that the gluteus maximus has been turned off. So we see a lot of glute dysfunctions in the normal population based off of people's tilt. So again, an aggressive anterior tilt causing compression in the lower back will then turn off the glutes here. We'll turn off the glutes and then would lead to more of a core function on the anterior side. The gluteus medius muscle, its main job is for abduction. So we see gluteus medius, it's one of the deep rotator muscles. It's one of the deep external rotators, but the anterior fibers actually do internal rotation often, or also. Its main job, though, if I was to star something, would be for abduction. So, laying on your side, just a simple leg raise would cause strengthening in the gluteus medius. The gluteus minimus also is the abduction. So anytime, say for instance, you do a normal squat and you put a band around your legs, you're essentially activating the gluteus medius and gluteus minimus. And then when you're going into a full squat, once you hit 90 degrees, then you're activating your gluteus maximus. It also does a little bit of internal rotation of the hip, but most often we associate gluteus minimus with abduction. The tensor fasciae latae muscle, its main job is hip flexion. So the tensor fasciae latae is a short muscle. You can see here how it then is interconnected to your IT band. So about that level, what we see is that it turns into the IT band. Eventually, it's going to target itself on the Gerdet tubercle on the lateral aspect of the tibia. It's also associated tight IT bands. It can cause a change in the front of the pelvis. So when we look at the ASIS here, anything tight, if we have an overactive tensor fasciae latae muscle, then what we're going to see is we're going to see a greater than normal anterior tilt, which basically means that the ASIS is moving into the anterior compartment, which means that from L1 to L5, we're going to see some sort of a compression. So when we look at compression, we're going to see that the lower back kind of builds a lot of compression due to the tight hip flexion that's occurring in the front. The most common problem in most people is going to be hip extension. So when we see people who have tight rectus femoris, tight tensor fasciae latae, tight sartorius, all that's going to lead into tight flexion. So the main problem that we see in the anterior compartment is going to be tight flexors of the hip, the inability to extend the hip, which is then going to lead into this greater than normal anterior tilt in the posterior compartment, which then can lead to compression or other problems. Thank you so much.